going on? This is David from Elevated PT and Fitness. Today we're going to start with some lumbar stabilization exercises. These are very basic exercises that we would start off with when someone's having some acute pain or something like that, okay? The important part here is to palpate so that you know that things are working how they should. You come right off your hip bone and you dig your fingers in just a little bit there on your stomach, not right in the middle. You want to be more on the outside. You should feel this muscle that we're working, the transversus abdominis, pressing into your hands while you're doing that. And the important part is to keep breathing during this, okay? You're gonna lay on your back. Generally easier to have your knees up because a lot of the exercises we do off of this have the knees bent up. So I'm gonna go off my hip bone, dig my fingers in a little bit here, and the cue I give a lot of people is pretend I'm gonna punch you in the stomach and you'll press that out, okay? Notice I can press out here, but I can still talk to you because I'm still breathing, okay? It is hard to do for an extended amount of time, okay? But in order to practice doing this and still breathing, I generally have people start with a press and then a breathe in, a diaphragmatic breathe in, and breathe out while you're still holding it. And then you can relax, okay? Once you get that motion down, that activation down, we can start to add a little bit of movement with it, as long as you're breathing appropriately, okay? So we're gonna activate that transversus abdominis, the TA, and then we're gonna add in a small march. I'm keeping this tight the whole time. And then relax, that's one rep, okay? Do a few of those. I'm gonna show you the whole series here. These get progressively more challenging as we go through. So if you can't do certain ones, you need to stop there, okay? Tighten up here, let a knee fall out to the side. And again, I'm still breathing through all of this. I'm not just holding my breath to get that spinal stability, okay? So those marches, then the knee fallouts. The next one is gonna be let the leg go out with a lift, back down, back up, and another. That longer lever arm gets pretty tough, okay? To hold this the whole time. The last one is gonna be a bridge, but paying attention to how you're bridging. So I'm tightening up here, and I'm bringing everything together by squeezing my butt up towards the ceiling. I'm driving the hips up. I'm not rolling up through the spine. Tight and press. Still breathing through these. Making sure this stays nice and tight. Start slow, practice right, breathe right. Let me know what you think.